Hello, my name is Weston, and I wanted to see how healthcare in rural America compared to healthcare in London. Made possible thanks to the University of Idaho. As a hopeful future physician, this trip gave me a perspective on what healthcare is and what it can be. I work as a scribe in 4 small clinics in Idaho. Moscow, 25,000 people, Troy, 900, Potlatch, 900, and primarily Kendrick, 300 people. To say the experience of someone living in London, a city of 9 million, versus one of these small towns is different would be an understatement. The trip was a phenomenal learning experience, and yes, there was indeed time to see the sights, Her Majesty's Theatre, the Natural History Museum, the London Eye, Parliament, Big Ben being renovated, and even not the London Bridge. The real one is now in Arizona, by the way. In small towns, a positive pickup sign is a saying providers have when a patient shows up as the passenger in a car. Essentially, if a patient can't drive themselves to the clinic in a rural town, they must be on death's door. This saying exemplifies a problem Londoners do not face: access to healthcare, geographically and financially, that is. London has a metro system with subways and buses. In rural Idaho, you need a car and gas money to see a primary doctor. Not only that, but many specialists and services are too far to reach. More than that, the cost of insurance is another significant hurdle. Part of the trip was taking an online course prior to departure. We learned about the history of the UK's National Healthcare Service, the NHS, and compared it to our own. It was established in 1948 under the direction of a man named Nye Bevan. He wished to create a system where a citizen is granted access to medical care for free. 71 years later, the vast majority of UK citizens have never had to directly pay for a medical bill. The fear of costs and financial ruin just isn't comprehensible to a UK citizen. On the plane, I had quite an interesting conversation with a British couple who loved my accent. They were so glad they've never had to worry about such things as hospital bills. Sadly, I know cost is one of the most significant hurdles people face to getting care where I come from. A great deal of the patients I see as a scribe are too afraid to perform tests or imaging because another diagnosis will just be one more thing to worry about, resulting from a diagnostic they already cannot afford. When we got the chance to meet with providers at a London clinic, they said it was hard to imagine having to worry about medical bills, both from the patient's perspective and the provider's perspective. I explained how physicians and I spend significant time strategically diagnosing and prescribing medications based on the patient's insurance, also known as coding, to minimize the financial burden for patients. The 2 providers responded that they believe having to worry about such things can distract from the root of the matter, focusing on how to better the patient's health. Not having to worry about billing takes a huge weight off not only their patients but also themselves. Money is just not as much of an issue for patients or workers in healthcare. Not only that, but providers have significantly much less debt in the UK than providers in the United States. That being said, it was intriguing to consider the trade-offs of having everybody insured. One critical rumor of the NHS is a high waiting time. We asked the GPs about this and they spoke to its validity. However, change is something that happens faster with their public system. They have a more streamlined organizational structure, including a universal record-keeping system which allows them to identify areas for improvement and take action much more quickly than we can in the United States with our legislative gridlock. Now, problems are screened and patients are prioritized when scheduling in a way that those who need to be seen in a timely manner do not have to wait for long. If there's a possibility that a patient has cancer, for instance, they will be seen within 2 weeks according to the clinic we visited. Slowly over the trip, I recognized they were much more on top of things in London. They are proactive with patients and with the system at large. The result seems to be cheaper healthcare and citizens with longer lifespans comparatively. With a cost-effective and responsive system in place, healthcare is allowed the freedom to expand outward beyond diagnosing and prescribing medications. To UK citizens and government workers, health is broader than physical ailments and disease. It involves community and connectedness, which can include the better utilization of space, the theme of a tour around the center of London, where the city has found ways to bring an element of nature, farm animals, sports, and fresh air to those who never get to escape a cement urban existence. It can include being more welcoming and accommodating, such as an initiative from the mayor's office to make London the first dementia-friendly city in the world, or finding ways St. Joseph's Hospice is working to understand biases with Bangladeshi immigrants and their different views on palliative or continuing care. A Catholic organization in its roots, St. Joseph has made efforts to welcome other religions and even keeps Qurans and Torahs available in its chapel. Health includes mental health and getting people to take ownership of their own well-being, the mission of a non-profit called Thrive London. London who wishes to decentralize leadership so that rallies become something the community takes identity over rather than their organization. Being in London, seeing all the history, the unimaginably old buildings, I was baffled by how more willing this country is to experiment, how they are open to trying things. We have never had to face the painful lessons Europe has in the past 200 years. We never had to be on the front lines of a war with death and injuries abound. Coming back home, working in these small towns, our approach seems disjointed. People, services, and even their health are spread out. The culture is one of hard work, independence, and self-sufficiency. People do not want to pay for their own health care, much less for other people. And for a long time, our nation has been rewarded for our isolationist attitude. I'm not sure a public system is something rural folks will ever accept. I don't want to pay for that, is the common response I get when talking about the NHS. America has a different mindset, and that won't change until we connect with the rest of the world. Visit and explore their way of doing things. Going there, seeing how much better things are, making it real and tangible. Whether we admit it or not, we are all affected by the well-being of others. We are social creatures, and when our friends or kin are not well, we are not well.